Akatin chitab kalenjin eng wui tugul ole imite itagat eng tetutieng'ung nebo tililindo rani kainenyu ko Chesang Karo Sirma kimite ak Tonyo Daktari Henry Dungu ko wendi kong'alalwech inendet akobo kaimutiet nebo korotik nelweldos korotik nekikure thrombosis. Ne atkan kora ko kokochang'a biik che ibeti sobonwekwak kosubkei ak korotik chekalwelyo. Ko kimite ak daktari kobun Uganda eng betut nebo rani keng'ololi agenge eng agenge komite kebeberta nebo Uganda asikoarorwech akobo nito. Dr. Dungu, welcome to Kass TV. My name is Caroline Chesang Sirma. Would you please take a minute to introduce yourself so that we move on with the program?
Hello, thank you so much for hosting me. My name is Henry Dungu. I'm a senior consultant, specialist in blood diseases, including blood clots and cancer. And I've been doing spokesperson work for the World Thrombosis Day, an organization for which I've been, volunteering as a member of the committee.
You're welcome. So, Dr. would you explain to us what is thrombosis, actually?
Thrombosis, in simple language, is blood clotting in a particular part of the body. So when you talk about thrombosis, we mean that your blood loses the ability of being in the liquid form when it's supposed to be moving, and then it solidifies. That's when we say it has thrombosed, and it forms a blood clot. A blood clot can form anywhere in any part of the body, but mostly it affects the big vessels that are deep inside one's limbs, especially the lower limbs. The veins mostly, but it can also affect the arteries in a special category of people. It happens when blood stops its natural way of remaining in the liquid form of it.
Mm-hmm. What causes thrombosis?
Thrombosis is caused by basically three factors. One is when blood ceases to be in its natural way of moving, what we call stasis. And the other reason is when blood becomes too thick for various reasons. Either you have factors in your body that make it too thick, or the natural environment makes it too thick, or when you have abnormalities in one's blood vessels, in your blood vessels, that make blood move in a way that is not, fluid enough. So there are a number of reasons that can put someone in those three risks. One, for example, if you are in a state of no movement, what we call stasis. For example, you are bedridden, you are admitted for a reason or something, or they have put a cast on your limb, you got a fracture, and then they try to immobilize your limb and they put a cast. Or you've been undergoing surgery and you stay in theater for a long time, undergoing surgery. Or if you're going, traveling for long hours and you are not moving enough, you are in a situation of no blood flow. And that is what we call stasis. And it is a risk factor for blood clots. The other reason is when people are, having inherited disorders that make their blood clot much more easier than before. For example, having the factor 5 Leiden mutation and other factors that can be passed on through generations, all when you are using, certain medicines that increase your risk of getting blood clots. We also know that certain conditions, especially diseases such as cancer and treatments for cancer, can be associated with an increased risk of blood clots. And situations such as, being overweight, or when you're obese, when you smoke a lot, when you drink a lot of alcohol, all these are situations that can increase one's risk of getting blood clots.
So, Daktari, How can someone know what are the signs and symptoms that you may be having blood clots or thrombosis?
Yeah, when you get blood stopping to flow in a blood vessel, it will accumulate and pile up. And one of the commonest symptoms is painful swelling of the affected leg. Sometimes the pain may be vague and deep-seated, and you might think, oh, I'm just having spasms. You even go for things like massage, but the commonest presentation is unilateral swelling over lower limb that is non-provoked. It's not because you've hit yourself on something or you had an injury, but you get unprovoked swelling over lower limb. It is the commonest manifestation of a blood clot. And there can be pain or there may not be pain. Depending on the complexion of the body, if you're light-skinned, you might see changes in the color of the limb. That is when you have a clot in the lower limb. But the symptoms are mostly swelling, pain, and discomfort in the limb. But when a clot goes to other parts of the body, especially if it goes to the lung, the term we call embolism, there you are going to get symptoms that are for a blood clot that is sitting in the lungs. Pulmonary embolism will present with difficulty in breathing, with coughing blood, with chest pain, and sometimes one may not even get those symptoms, they'll just collapse. If they're not taken to hospital immediately, then they'll get into big problems, including dying sometimes. So these are some of the symptoms, of a blood clot. But to sum it up, it's mostly painful swelling of a lower limb if you're getting a blood clot in the leg. Unfortunately, many people will overlook that until when they present with symptoms of difficulty in breathing, and then when they reach hospital, they're told they have a blood clot.
How is the diagnosis? Because maybe majority of cases which we've had about someone, just the way you've explained, someone just collapses all of a sudden and gone like that. So how is the diagnosis?
To diagnose a blood clot, first of all, everyone should be aware of the risk factors that they may be having. Because if you're not aware of the risk factors, you may actually miss the symptoms that will be telling you have a clot. I talked about risk factors, for example, being in hospital, having diabetes, having heart disease, having traveled for long, being in a situation of not movement. If you have any of those risk factors, and then you develop symptoms I've talked about, including swelling of a limb, pain in the leg, or difficulty in breathing with chest pain, you know that you could be having a blood clot. And you need to run to hospital immediately so that the experts can confirm. In the hospital, we will take a proper history and physical examination to understand exactly what could be the other possibilities that we need to rule out. And then after doing all the evaluations, we can go ahead and do certain tests. There are some screening tests that we use when we suspect someone has a blood clot. For example, we can take off a blood sample and look for, breakdown products of a clot. We call that a D-dimer test. It gives us an idea of whether you might be having a higher risk of having a blood clot or not. And then there are other tests that we are able to do. These tests will include, scan of the affected limb. We do ultrasound scan, and if the clot is in the lungs, we might go ahead and do more advanced tests, such as a CT scan of the lungs to identify the vessels, whether they have, they're being blocked or not blocked by a blood clot. But I'll tell you this, any person, when you suspect a clot in the lungs, that high index of suspicion is the best to diagnose a blood clot. Because if you're going to wait for sophisticated investigations, it might get too late. That's why I'm going to emphasize the importance of being aware of one's symptom risk factors. And then when you have symptoms, you notify immediately so you can get treated. The reason I'm again insisting on immediate treatment is because blood clots are dangerous. Blood clots can be fatal if not diagnosed early and treated properly.
How about the statistics? How many people are affected? We are looking at how many people.
Well, I think the global statistics is very, very simple, that 1 in 4 persons globally will die of a condition related to thrombosis. Either someone is going to die of a clot in the lungs, or they're going to get a heart attack, or they're going to get a stroke. So if you look at all those conditions globally, 1 in 4 persons will die of a condition that is related to thrombosis. This is a very, very high number. It is bigger than when you look at tuberculosis, when you look at malaria, when you look at cancer, and you combine all these, the risk of dying from a blood clot is very, very high. And when I talk about a blood clot, it's not only the clot in the lungs or in the legs, but I'm talking about you get a clot in the small vessels of your heart, that is a heart attack. You get a clot in a small vessel of your brain, you get a brain attack, or what we call a stroke. And all these are fatal. So blood clots are common. Of course, in different countries, many people have not done the national statistics to understand. And the reason for this is because there hasn't been a lot of focus to, encourage people to do research on such disorders, because even in countries like where I come from, we are very, very few specialists in this kind of, medicine. So getting the local statistics is not as simple as we would have thought it to be.
Daktari, what should we do to prevent these preventive measures?
Prevention is extremely important. At World Thrombosis Day, we emphasize the importance of prevention. That's why we emphasize the importance of understanding about blood clots. When you understand, you are able to prevent. When you understand the risk factors, especially the modifiable risk factors, then it becomes easy to prevent. For example, smoking causes many diseases, including blood clot. Prevent it by not to smoke. Don't drink too much alcohol. Don't stay in one place. Be active. Be active and move. You need to move against thrombosis, because the more you move, when your blood is moving, it cannot clot. Okay? So we need to make sure that we are moving. We need to make sure that we fight obesity. We need to make sure that when we are admitted in hospitals, we talk about, tell the doctor in the hospital that, doctor, am I at risk of getting a blood clot? So that the doctor remembers and they will say, oh my God, yes, you could be at risk. And then they'll take the necessary precautions. Many doctors have a lot of things on their mind. When you're admitted, thinking about thrombosis might not be their priority, not giving it the necessary attention that it deserves. We need to keep active. We need to eat fruits and vegetables to prevent other diseases, and make sure that you exercise regularly to avoid other conditions. Those are some of the ways. But being aware of risks for thrombosis is one way of preventing, because if you're traveling, for example, and you know that if I sit in this chair for so long, I might get a blood clot, especially if I'm above 50 years or 60 years. Not that young people won't get a blood clot, but as we grow older, we have eyes, so the chances of getting a blood clot increase.
On that note, that Henry, there is this rule of 60 to 60.
Yeah.
Would you please explain?
Yeah, the risk of blood clots increases as we advance in age. young people get blood clots, but rarely. And usually if they are to get a blood clot, it will come in maybe following a medical intervention. For example, if they insert a cannula or a catheter into a blood vessel, they can get a clot following that. Or when they have conditions such as cancer, they can get. But not as common as someone who is above maybe 50 years. Because after 50 years, you have a number of issues. One, your blood vessels naturally get smaller. And they also get, especially the arteries, they might start getting, things like fatty material because of a lot of abnormal lipids, and end up getting complications like that. So after 60 minutes, people are diabetic, they have hypertension, some have developed cancer. So there are a number of reasons that can make you or one who is above 60 get blood clots. And I'm not saying that whoever is above has a problem, but the risk increases if you are to compare with young people.
Okay, thank you, Dr. Again, we would look about, you mentioned about the Thrombosis Day, and you being the spokesperson of the Thrombosis Day, which you did recently. What really pushed you to start such a day, or to recognize such a day?
You know, World Thrombosis Day is a campaign to raise awareness. It's a global campaign to raise awareness, because blood clots do not discriminate. Blood clots can affect anyone in any part of the world. That's why the International Society for Thrombosis and Hemostasis came up with this World Thrombosis Day event, which is meant to be, a global event that happens every year to raise awareness about blood clots, to raise awareness about how we can reduce on, suffering and dying associated with blood clots. That's why there is World Thrombosis Day. And, it has volunteers who are experts in blood clots who get involved in educating people, in reaching out to people, but also it brings on board those who have survived blood clots, or those who are enthusiasts in supporting prevention of blood clots. So there are a number of supporters who come in to help in stopping blood clots. That's why we have this event, which happens every 13th day of October of every year. And this year we made
Thank you, Dr. So let's take a short break and then we'll come back.